This video is the second in a three-part series on deaf adopted children, focusing on how factors like trauma and attachment impact their learning and education. In this video, we're going to explore how trauma and neglect impact a child's development and thus their ability to function and learn in the educational environment. First, we're going to discuss trauma, what it is, and how it affects children. Trauma is defined as the experience of a distressing event or events which overwhelm an individual's ability to cope. This definition highlights that trauma is more than just a stressful situation. The stress has to be to a degree to which it surpasses the individual's capacity or their tolerance to deal with stress. The stressors that can cause trauma come in a variety of forms. For children who are adopted, there's a high incidence of abuse, and this abuse can be physical, sexual, verbal, or emotional abuse. Research shows that children with special needs, such as deafness, are even more frequently the victims of all forms of abuse. Trauma can also result from witnessing violence or other situations that induce intense fear, or that they are not developmentally ready to handle. Abandonment or loss of parents or other family members is a common stressor in the past of adopted children that can be traumatic in nature. Sometimes the massive changes that a child can experience in moving from one culture, or people group, and language can itself be traumatic to children as well. An important thing to know about trauma is that it can occur at any time in a child's development, including before they're even born. Studies show that a variety of things such as drug and alcohol use and even stress levels in the mother during pregnancy can have a detrimental and a traumatic impact on the developing child in utero. Complications during birth can be another way in which an infant experiences trauma, and this can also have a significant and lasting effects on their development. In infancy, the experience of intentional harm like physical abuse and even stressors such as medical conditions or surgeries can cause trauma for that child. And obviously, as the child progresses into childhood and even adulthood, trauma can have a major impact on the development of that child. The primary point I want to make is that trauma can occur at any time during a child's life, starting even before they're born. And as a result, just because a baby went straight into their adoptive home as soon as they were born, it doesn't mean that there were no traumas that occurred in utero that could have a significant impact on their future development and functioning. In the following slides, I want to show you the impact that trauma has on the brain. In this first slide, you see that primary areas that have been found to be most impacted by trauma. And you can see some long and complicated technical names for 4 different parts of the brain that have been found to be different in some way in individuals who have experienced trauma and therefore represent damage. These parts of the brain are found in 2 specific areas called the frontal lobes and the limbic system. The frontal lobe is like the control center of the brain that manages things like initiation or the starting of behaviors or the inhibition or stopping of behaviors. Planning, organizing information, along with focus and attention are all controlled by this part of the brain. The limbic system is the primary center for emotions and learning and memory. So obviously, damage of any sort to these areas of the brain will have a significant impact on the behavior and functioning as well as the development of that child. This slide shows the results of a study that examined the differences in brain activity levels in normal individuals without a trauma history and those who have been diagnosed with post-traumatic stress disorder or PTSD. The individuals in this study were given instructions to merely fix their eyes on a point of light to create a resting state for their brains, while a special type of brain scan called a MEG measured the electrical activity in their brains for 1 minute. What they found was that individuals exposed to traumas had a significantly higher level of activity in several areas of the brain, much more so than normal controls. So what we see is basically an overactive brain when it is supposed to be in a resting state. It's likely that this activity translates into behavioral and emotional reactivity in children, which is exactly what we see in kids and adults who have experienced trauma. This next slide shows a brain scan that measures the level of a specific neurotransmitter chemical called serotonin. On the left, you see the brain scan of a normal control, meaning no trauma or mental health issues. And on the right, you see an individual's brain who has PTSD. What you can see is that the levels of serotonin is much lower in the individual with PTSD. So what does this mean? Serotonin functions in the brain to regulate mood, appetite, and sleep. It also plays a part in cognitive functions such as memory and learning. So we can see that an individual with decreased levels of serotonin is likely to have difficulty in those specific areas, which is exactly what we see in those with trauma. This last brain scan shows an MRI image of a normal control on the left and an individual who has chronic or long-lasting PTSD. At the bottom of the slide is a magnified section of the scan above it, in which the hippocampus has been outlined and identified by an arrow. Now, it's easy to see a dramatic difference in the size of this part of the brain, with the individual with chronic PTSD having a much smaller hippocampus. Now, the hippocampus is primarily concerned with memory and learning, and so we see that trauma has a visible effect on this area of the brain that is highly important for learning new information and retaining it, obviously critical to the educational process. So, these 3 slides of brain scans, in them we see a solid set of evidence that trauma affects the activity level, the chemistry, and even the structure of the brain. So it's not hard to imagine that children who have experienced trauma will have behavioral and learning issues as a direct result of the changes in their brain that have occurred as a result of exposure to traumatic events in their past. So, how do these changes translate into changes in functioning? A multitude of studies have examined the functional and behavioral impact of trauma on an individual. And one of the primary things that is seen are cognitive difficulties in learning and attention. So, for children with trauma in their background, you're likely to see problems staying focused and difficulties remembering and learning new information, key factors needed for the success in an educational environment. Impaired impulse control is another consistent finding in individuals suffering from trauma. This deficit is a primary contributor to behavior problems for many children. And so for adopted children with trauma backgrounds, we should expect to see more behavior issues stemming from a poor ability to control various impulses that those children have. And this will most certainly lead to a number of problematic and disruptive behaviors in the classroom and at home. Thirdly, we see a high number and severity of sensory issues in individuals who have experienced trauma. We know that sensory problems can be a significant issue that can interfere with both learning and behavioral control. If tags are itching or the whining of the lights can't be ignored, attention and therefore learning begin to suffer. In addition, this chronic sensory overload can lead to irritability and erratic emotional expression and problematic coping behaviors. Trauma also has a significant negative impact on the ability of a child to form attachments with others, leading to difficulty in relating to peers and adults in their life. The inability of a child to trust their teacher and to form an age-appropriate working alliance with them leads to behavior problems and a more limited ability for that child to benefit from the teacher's instructions. Difficulties in making and maintaining friendships is a significant contributor to emotional struggles, behavioral acting out, and self-esteem problems in children. All of these things can create major roadblocks in the learning process for that child. Another significant impact that is seen in adopted children with trauma is a dysregulation of emotions. What is often seen as a high emotional reactivity combined with a diminished ability to manage or control these emotions and a greater difficulty in recovering from emotional overload. Often these children will be overwhelmed by everyday stressors, and then they will express their emotions in very disruptive and maladaptive ways and struggle to regain composure and return to a normal level of functioning after that. Finally, we see a strong connection between a history of trauma and aggressive and self-destructive behaviors. When a traumatized child is overwhelmed, they can often respond with anger turned outward on others around them, resulting in physically or verbally aggressive behaviors to adults and peers. That anger can be turned toward themselves and take the form of destructive behaviors aimed at themselves or their own possessions. It's easy to see how even just one or two of these areas could be a detriment to a child's learning. It is not unusual to see most or all of these problems in the lives of adopted children. So for adults working with them, it's critical to understand that difficult behavior and poor school performance are the result of brain changes leading to cognitive and behavioral changes that may look like willful defiance, but actually reflect the real physiological changes brought about by the traumatic experiences of their past. While abuse and trauma are often recognized or at least understood contributors to an adopted child's difficulties with behavior and learning, neglect tends to be a much less known or appreciated factor in these children. Neglect can be simply defined as the failure to adequately provide for the needs of a child. These needs can be physical, such as food, shelter, and medical care. They can be emotional needs, such as the need for belonging, inclusion, affirmation, being valued. These needs can also be educational, intellectual, and social in nature. What's seen in most situations of neglect is that neglect spans many of these areas of needs and rarely just one. What many don't realize is that child maltreatment through neglect is a far bigger problem than any of the other ways that children are mistreated, including physical, sexual abuse, and psychological abuse. This chart shows the number of substantiated reports of child maltreatment in the U.S. according to the type of maltreatment. The top bar representing the number of substantiated neglect reports that is almost 5 times greater than physical abuse, the next largest category of maltreatment. And if this general trend is true in the modern and wealthy nation of the U.S., it's sure to be even more true of other countries with less resources and less development of services and even awareness. It's tempting to think that because neglect is a lack of action on the part of caregivers rather than an abusive and damaging action, that it must not be as hurtful to a child. However, research looking at severe neglect seems to indicate that neglect can be far more damaging to a child's development than abusive experiences. This slide shows CAT scans of 2 children's brains. The scan on the left is a normal 3-year-old who has been raised in a typical home with parents. The scan on the right is that of a 3-year-old who had been raised in an orphanage in Eastern Europe. It doesn't take a skilled radiologist to conclude from these scans that the brain development in the child from the orphanage is dramatically behind that of the typical child being raised in a home with his parents. The chart shows the difference in the total number of white matter between children who had lived in a Romanian orphanage on the left and those who had started life in the orphanage but were moved to a foster care setting in a home in the middle column. And finally, children who were raised in a normal home environment. They found a significant difference in the total volume of brain tissue as a result of the environment that the children were raised in. Another study, looking at the same issue by measuring the brain activity or electrical impulses in children who were institutionalized or raised in an orphanage and in those who were not. In this slide, we see on the top row the electrical activity at 3 different levels for an institutionalized child. Red and orange indicate higher levels of activity, while blue and green represent less. On the bottom row, we see the same 3 levels for a child raised in a typical home and see dramatically higher electrical activity in many areas of the brain. What these slides show are the devastating effects of deprivation that children in orphanages experience. While some of that neglect may be nutritional, it does not explain these significant changes. What research in brain development has helped us to understand is that it is primarily the stimulation that occurs in normal parenting in a normal household where babies are held, talked to, soothed, and whose needs are quickly responded to. This not only builds a bond between the child and the caregiver, but actually is a key component in building that child's brain. So what are the effects of the brain changes that we see in children who have experienced neglect? Research has found that these children have delayed development in both physical and cognitive development. We also know that the earlier a child can be moved from a neglectful environment into a healthy home, the more they're able to catch up in terms of their development. But we also know that some changes are permanent, and the longer the time in a neglectful environment, the less catching up may be possible. Secondly, neglect is strongly related to problems with attachment and relating to others. Because the template for trusting healthy relationships is built in those first few years of life through the interactions and the meeting of the baby's needs, if this template doesn't form in a healthy way, then subsequent relationships are often shaped by this unhealthy template, regardless of the quality of the caregiving in a new environment. Anxiety and depression are commonly seen as neglected children develop. They demonstrate a vulnerability to these mental health issues that appears to often continue into their adulthood. Behavior problems of many types have been correlated with neglect in children. Acting out behaviors such as lying and stealing, as well as aggression and defiance, are often seen in these kids. Another result of neglect are a variety of physical and health problems that are seen in this group of children. Early neglect predisposes a child to a number of future health issues. A likely cause of this is the fact that chronic stressors such as neglect seems to have a very lasting effect on the immune system, whose function is to keep us healthy. Trauma and neglect are extremely common aspects of children who are adopted. These are factors that in this country lead to them being removed from their biological family and ultimately create the need for a child to be adopted. Children adopted internationally typically come from an institutional setting in which are full of neglect and abusive environments, often due to the lack of resources and the care or the ability to care adequately for the children, as well as a lack of knowledge regarding what the needs of the child are and how to meet them. These realities of trauma and neglect result in adopted children exhibiting behavioral, relational, and cognitive deficits, all of which can interfere significantly with their ability to learn and function in the school environment.